I want to know how many people, not a personal example, how many people are you referring to that are, this is happening, are doing this, that's blowing up this malpractice cost? Facts and figures.
Well, the big question is, what's the bottom line?
You're pointing a finger somewhere, and I'd like to know.
The big question is the bottom line. The research team out of the state of Washington said close to 20%. Okay? The question isn't how many people, the question is how much money are we wasting. Let me give you the personal example because it tells the story. I'm on, by the way, because I've been self-employed most of my life, I have chosen medical insurance as $5,000 deductible because I think that's the most, I get the most for my money. So 5 or 6 years ago I had some digestive system problems. I went to my general practitioner. He recommended a CAT scan. And I asked him, you want to see if there are any tumors, right? And he said, yeah. I said, well, that makes sense. That CAT scan cost me over $1,800. Okay? Am I willing to pay that? Yeah, because that's probably a good idea to find out if I have any tumors. So I had the CAT scan, $1,800. I want you to know, because I'm an avid fisherman, I'm thinking of all the fishing lures I can't buy when I'm paying $1,800 for a CAT scan. Okay? 5 days later or so, I get a phone call from the general practitioner, and here's what he said. He says, Al, I've got news for you, both good and bad. You want the good news first or the bad news first? And I said, well, give me the good news first. He says, well, the good news is you don't have any tumors. And I said, well, that's good news. What's the bad news? The bad news is we didn't get a good look at your pancreas. And I said, okay. So we want to do another CAT scan. And I'm thinking another $1,800 and all the fishing lures I can't buy again because I'm spending $1,800 for a CAT scan. Now, because I'm paying out of my own pocket, and tax laws can encourage high deductibles, which are a factor in getting down medical costs. Because I pay out of my own pocket, I start asking questions. And after a couple questions, I asked the medical doctor, I said, okay, now tell me, are you recommending another CAT scan because you think it is medically necessary for me, or are you recommending another CAT scan to protect the clinic from malpractice suits? Okay? There was total silence on the other end of the phone. Total silence for about 15 seconds, and then finally this doctor, who I have the highest regard for, cleared his throat and said, well, the reason I'm recommending this is to protect the clinic against malpractice suits. That's what defensive medicine is all about, and that is a huge waste of our resources when you have the medical community feeling it has to do all kinds of tests or whatever to protect itself against malpractice. This is real world. This is how it works. Now, you know what I said to the doctor. Well, if this is all about protecting the clinic, I'm not going to pay $1,800 to protect the clinic. All right? And that's one of the reasons why high deductibles brings down costs. So is this one of the things we have to do? Yes, it is. I also think there should be limits on awards that are given in malpractice lawsuits. What else can we do? Well, Minnesota has something like 60 mandates that insurance companies have to offer, and you can't write insurance without that. Let me give another personal example. I'm trying to buy health insurance for our family, and the person that I'm going to happens to be a State Farm agent, says this shouldn't be a problem. We have to do, get all kinds of information. I talked to him. He contacted me 10 days later and said, sorry, we can't insure your family. Why not? You have a daughter with asthma. Okay, well, just take asthma as a pre-existing condition that you're not going to cover. He said, Minnesota law prohibits us from writing that policy. Okay? They had to cover asthma, even though it's a pre-existing condition. They said, we can't write that policy because you have a daughter. And when you've got 7 daughters, somebody's going to have something. Okay? What kind of sense does that make? Why not let the consumer decide what makes sense? Why not let the consumer shop in different states, which by Minnesota law is prohibited? Why not have tax laws that encourage providers to advertise their costs, like people do with LASIK surgery. So there's a lot we could do in the private sector. Yes?
Did you check out the cost of that CAT scan before you had it done?
I didn't, no.
My CAT scan cost $600
Where did you get it?
in here at the Mayo Clinic in Alberta.
See, this is what I should have done. Yeah, my hat's off to you. So whatever we can do to empower consumers to shop like that is going to help. So there are a lot of things that can be done to get medical costs under control. Yes?
Isn't that what Obama's law does? Is it forces insurance companies to cover pre-existing conditions?
It forces insurance companies to cover pre-existing conditions. It adds $2 trillion to the debt. We don't have $2 trillion. It also interferes with our freedom to make health care choices.
What are you going to do with all these people who don't have insurance? They wait till they get sick and then they go to the emergency room, and we people who have insurance have to pay for it.
Well, there are a lot of things we can do to deal with that without having a socialized system. So, but you and I may disagree on that.
Like how are you going to do it?
Like what?
So are the two of you, are you committed to Obamacare? Is that what you're saying?
Well, I like that part about pre-existing conditions, and I like the part about going to 26 on your, your parents' health insurance.
Well, let's talk about the pre-existing conditions. You could have a subsidized system or policies for people with pre-existing conditions. I think that's probably a good idea. But you don't need to socialize the whole system to deal with people with pre-existing conditions. That, to me, makes no sense whatsoever. Any of the problems we're dealing with, we can deal with without socializing the system.
Are you currently on Medicare?
Am I currently? Sure, I'm on Medicare. Sure. And am I opposed to Medicare? No, I think Medicare is a good system. But the debt is a substantial threat to meeting our obligations. Okay, so we want to meet our obligations to Medicare, Social Security, veterans benefits. Obamacare is going to add $2.4 trillion to the debt. We are in a much worse position to meet our obligations for anybody and everybody. We have to live in the real world, folks. Living in a fantasy world doesn't work. The party is over. The party is over. We can't keep spending money we do not have. We cannot continue to spend our children's money. That's what we are doing. I don't think there's anyone here who thinks that this is acceptable. If you think this is acceptable, raise your hand. There isn't anyone here who thinks this is acceptable. Right? So we have to get serious, we have to prioritize, we have to balance the budget. The only way you're going to do that is by shrinking government. We have to get back down to the 18% level. Yes, sir?
How about the farm situation? The government subsidizes farmers, and they're going to subsidize this insurance, I guess.
Right.
And you're a farmer.
I am.
How much did you get subsidized?
Well, let me put it this way. First of all, keep in mind the farm bill is 80% food stamps. All right?
Yeah, that's right.
And I object to articles in some places that talk about the farm bill as though it was primarily a matter of subsidies for farmers. It's 80% food stamps. So it is the food stamp bill with farm program riders. All right? That's what it is. It's not a farm bill. It's a food stamp bill. Now, does that have to be on the table with everything else? Yes, it does. So what's the problem? The problem is the way the food stamp bill with farm program riders has been dealt with in the last few weeks in Congress is it has been dealt with in isolation, apart from the big picture, apart from how much we can afford to spend. And that's why we have the debt that's totally out of control. You have to set a limit, and then you have to say we can afford this much for the food stamp farm program rider, and this much for national defense, and this much for this, and this much for that. We cannot continue to take bills in isolation and just keep adding stuff. Okay, this is the process that has to change. And if you are not willing to change that process, we are headed for default. That is the choice. That is the choice. So think about that. If you're not willing to change the process where we set a limit on how much we can spend and divvy that up per area, then the Australians are right. And we are headed for financial collapse. And that is not where we want to be. Bob, question?
Let me just change the
Sure.
agenda here just a little bit, if I may.
Sure.
I am 100% Republican, okay? Whether you get the nomination, the Republican nomination, or Mike Perry does, I will vote for you over Tim Walz any day.
Good.
However, I'm a little bit worried about electability. Last 2 years ago, I thought we had the perfect candidate. Randy Demmer, I thought, was a great guy, and I think the only reason he got beat is because he got hammered the last couple weeks of the campaign about his farm subsidies.
No, well,
Walz just beat the...
Let me just stop you there for a second. It was, in his case, it was largely the business subsidies, but there were farm subsidies too. Go ahead. So it's both. Yes.
And so, I'm going back a little bit to that question.
Yes.
Have you received farm subsidies?
Absolutely. Every farmer has received farm subsidies. So, but let me say, when I first declared as a candidate, the Democrats criticized me for taking farm subsidies. And my answer was, if you don't like farm subsidies, you better go and talk to Mr. Walz. He's the one that voted for it. Okay? He's the one that voted for it.
He's the one that hammered Demmer on it.